Diabetes in America was written to serve as the go-to book for everything you ever wanted to know about diabetes but were afraid to ask. It's sort of the Wikipedia of diabetes. It is very, very comprehensive. It is data-rich. We wanted Diabetes in America to appeal to a broad range of people. They could be people with diabetes who want to know a little bit more about their condition. It could be people who are clinicians who want to advise their patients and confer with their patients about next steps and best treatment. It could be health policy planners in trying to plan best medical care, and also for researchers who really want to know the gaps in research. There are some surprising facts that have come out in Diabetes in America. So hearing loss is much higher in people with diabetes compared to those without. Periodontal disease, there's a chapter on oral health. There is much more gum disease in people with diabetes compared to those without, which is responsible for tooth loss. There is a higher rate of urinary incontinence, erectile dysfunction, of dementia, of depression. We have separate chapters on the genetics of type 1 diabetes, the genetics of type 2 diabetes, because there's been such expansion in these areas over the last 20 years. This is not just a chart book. It's not just tables and figures. There are pages and pages of explanation and observations that illustrate the points that are being shown in the figures in the tables. There are figures that can be downloaded for people to use in slides. Researchers can use them. Researchers should think of it as the basic place to go, the springboard for further things they want to ask. So for this, they're going to get a comprehensive view of a particular topic in diabetes that they may be interested in. And from that, they will go to PubMed, for example, and get more specific information, more detailed information that is more focused. So there have been many, many individuals who have contributed to Diabetes in America. This was really a 10-year effort, and I really want to thank every individual, because it wouldn't be the product that it is were it not for all of the group effort.